Aloha! It's Dr. Russ Rosen. So I have a question for you. It goes like this. Why is it that happy patients drop out of care? It can be so frustrating when that happens. Look, I hear this all the time. Doctors will tell me the patient loved me. They loved the care that they were getting. They were getting great results. I did a great visit one and visit two. They understood the process. They signed up for an entire care plan, blah, blah, blah. Yet happy people drop out of care. Why is it? Well, it's because they're happy. They're happy with care. They don't really get the bigger picture, or they do, but there are very specific points along the way that we didn't handle what needed to be handled. And if we don't understand these, we're doomed to recreate the same problem over and over and over again. And it's frustrating. So, why is it? Why is it that really happy people drop out of care? Well, is it possible that they really weren't that happy? Yes, but I'm not talking about them. I specifically am talking about the ones that really are happy. So, is it possible you did not do a great consultation, examination, and report of findings, and they really don't understand the value of long term care? Yes, that's possible. It's why we use the path to optimal health. So, -10 is near death, 0 is comfort, and +10 is I am as healthy as I can be, right? I've resolved my underlying issues. I'm not just feeling good, but I'm functioning at my optimum. So we walk them through this process. We get very clear about where do you think you're at? Where do you truly want to get to? How long do you think it would take? How motivated are you to get there? What kind of changes would you need to make? What would you hope for if you got there, right? So we walk them through this process. I'll show you how to get a free one of these if you like. Um, and if we do that, at least we know that they were really clear about they just want to feel better or they really want to get healthy or somewhere in between. Now, let's assume that you did a good job with that and they get it. But the problem is you think because they got it, they should own it forever. But they don't, right? They forget it. I mean, think of how many times you need to be reminded about your exercise or your diet or whatever it is. So oftentimes we blow it because we think that they got it and they did, but we think that they own it forever and they don't. There are very specific things along the way. So one of the things we also do is we have them fill out this outcome assessment questionnaire. So in our outcome assessment questionnaire, again, if you want this, I'll show you where you can get that for free. Here are their symptoms. That's what they came in with. All of this is what they're noticing changing physically and mentally and emotionally as they're getting healthier. And all of these questions are what is changing in their life and their lifestyle. Okay. So we get really clear that there's so much more that they can hope for as they're getting healthier. And we expect these things to happen, and we're going to monitor them over time. So they have something very clear to look forward to. Okay. So here's where most of us drop the ball. We drop the ball in the regular daily visits. We either just talk about their pain and symptoms, and then after it's feeling better, what do we talk about? Right? How do you talk to somebody who hasn't had any aches or pains or symptoms in years? What is the discussion like? Okay, there's a lot to that. But here are some of the things that will help you keep the story going. It'll keep the thread of the story going where we can check in with them and be clear about where they're actually at and do they still want to continue, right? Done the way I'm going to recommend it, you'll see that there's never a reason that somebody should just drop out like that. They would have a discussion with you first if they were feeling better and want to leave, etc. So one of the questions that we need to do in our regular daily visits, and yeah, I have an entire hour on this one question right here in our club. But one of the questions we need to ask is, what do you think that is? So somebody says, wow, I'm actually starting to feel better. Wow, why do you think that is? Well, if you get, I don't know, we've got a problem. right? Well, my low back is starting to feel better. Far out, that's wonderful. What about your bowels? How are they doing? Man, I've been pooping like a racehorse. This is great. Far out, why do you think that is? So we have to ask very specific questions to get them to say, if you're a chiropractor, if you're doing other things, they would answer what it is you're doing, but I'll just speak for myself as a chiropractor. Um, because you've been adjusting my subluxation, so I'm getting proper nerve supply, and I've been eating better, exercising, and dealing with stress. So therefore, I'm healing myself on all levels. That's why I'm feeling better, and my bowels are doing better. Again, if you want to dive into that one question, I have an entire hour on this. Again, I'll show you how you can jump into that for free at the end of this. Now, another really, and also I'm feeling worse. So sorry to hear that. Why do you think that is? Right? They need to be able to clarify. I understand three things can cause or aggravate subluxations, and I was doing this or not, but we need to figure out why. We need to address this. Okay, I have an hour on that one question. Another question that we would ask when they're feeling great is, where do you think you are? So originally you thought you were a -4 and you wanted to get to a +10 and you're starting to feel a whole lot better now. Where do you think you are? So if they say, I think I'm a 0, I'm going to say, I'm so glad we're having this conversation. You'll remember we said it would probably take around a year or however long it would be for you to get to this level. But we figured in that first month, you'd start to feel better. How long has it been? 3 weeks. How are you feeling? Better. Do you think you're here? Oh, right. I'm probably not. Where do you think you're actually at? Well, I'm probably down here. Right. So there's very specific conversations that we want to have with these people so we are clear about where they're at and where they want to go. Right. So if someone says, yeah, I'm actually probably around a +1, the next question I have to ask is what? Think about it. Do you still want to get up towards optimal health, or are you happy where you're at? Right? These are very specific Socratic questions that we've got to have. Um, then we need to build value for the re-eval report. Okay, so most of us really drop the ball here. I'm really excited. In about 3 visits, we've got a reevaluation coming up. So, where do you think you're at? Where do you want to get to? Oops, you still want to get to this level? Or are you happy just here? How often do you think you need to be coming in? Right? I'm not going to just do it because they say so, but I want to get a finger on the pulse. There's no way to come back from when they come into the report and they think they're done, and you tell them it's time to go from 3 times a week to 2 times a week. There's no way to recover from that. So don't find yourself in that situation. There are very specific conversations that we want to have with people. What would be your next health goal now that you're symptom free? Leap tall buildings in a single bound? Like, what would it be? Okay, so then the last piece is the actual re-eval report. We just don't have time for that right now. But again, I do have an hour on that subject if you would like it. So the reevaluation is the Achilles heel for most natural healthcare providers. Many of us just don't do it, and if we do it, we suck at it. So there's real critical things that we need to do. If you would like access to this for free, our outcome assessment questionnaire for free, we've got an hour on the consult, on the exam, on the report of findings, very specific pieces of each of these where we go into an entire hour. These daily interactions, the questions we were just talking about, specifically what needs to happen in a re-eval report. I will give you a free month in our club. The club is normally right now $63 a month. It's going up. If you're happy, stay. If you love it, and if don't, leave. So you can go ahead and get a free month in there. Look at all that material, download these things. And again, if you're happy, stick around. We also do 3, check this out, 3 live discussions per month. Not me lecturing at you like this, but you're on the call, we're in Zoom, we're bringing up concepts, we're talking them down with you to help you clarify how to best integrate it into your practice. So my hope is that you get a better understanding of why happy people stop and some specific things that you can do about it so that people can stick around long enough to get the kind of results that we really want them to get. Because the reality is, the longer they stick around under regular care, the better results that they're going to get. So again, if you would like access to the club, go ahead and let me know. I'll give you a free month. Again, come and go as you like. As always, much love and aloha. Bye, gang.